So I would like to introduce to everyone here Daniel Rasmussen. He is a nationally certified diplomate of Oriental Medicine and East Asian Medicine practitioner, licensed to practice in the state of Washington. Good morning from Bellevue. He graduated with a Master's of Science in Oriental Medicine from the prestigious Bastyr University here in Seattle. And in 2008, he did a residency in Shanghai, China, studying with some of the world's leading stem cell researchers and doctors in regenerative and integrative medicine. He's featured in the Continental Who's Who. Continental Who's Who is one of the growing publishers of professional and executive biographies of business leaders and Who's Who in the world of achievers. He's also received the 2019 Top Doc Award for Integrative Medicine Specialist, of which we are very proud of. He is the founder of Pinnacle Integrative Health, and he built a team of Western doctors and East Asian medicine practitioners who work side by side to discover the root causes of chronic disease and pain, and then treat the causes, rather than managing the symptoms with medications. Our team here is just phenomenal and passionate about helping people and achieve their health and wellness goals. We're excited to have him educating us today, and we're very grateful that you guys took the time and the commitment to be here with us. Before we start, I just want to make two promises to everybody on the webinar today. Promise number one, this will not be a waste of your time. We are going to dispel myths about digestive disorders and provide you with information that could change the course of your life. The second promise number two, during the webinar today, you will be given the chance to have a complimentary evaluation of your case and to see if this approach is the right fit. It's not for everyone, but our team on the webinar today will be reaching out to you during the webinar to set up your complimentary consultation so you can find out. Lastly, I want to point everyone to the chat box feature. It should be on the right of your screen. If you have any questions at all, please put them there and we will field them at the end of the webinar or when we have a chance. So without further ado, everybody, Daniel Rasmussen.
All right, thanks, John. Okay, everybody. Looks like we've got, again, if you guys can just put in the chat, type in the chat box at the bottom, let us know where you're tuning in from. I know we've got one person from Bellevue. Just let us know where you're signing in from. All right, so today's topic is the truth about digestive disorders. And it's a topic that I'm excited to share with you guys. Looks like we've got someone from Ramesh from Seattle. Awesome. Welcome, Ramesh. Manaz, you're from, okay, you're stating some issues that you've got. Yeah, if you've got some digestive issues, you're in the right place today. So I'm gonna share my screen. We'll kick this thing off and get started here. Okay, so the truth about digestive disorders. Again, my name, John, thank you for the great introduction. If you're tuning in a little bit late, again, my name is Daniel Rasmussen, East Asian medicine practitioner, diplomate of Oriental medicine and certified functional medicine practitioner. And we're gonna dispel, I'm gonna make a couple of promises today. Promise number one is I'm going to dispel a lot of misinformation that's out there. You know, yeah, we've got more information at our fingertips than at any time in our history of human civilization. But yet we're getting sicker every year. We have more IBS diagnosis every year than the year before. You know, heart disease, there's more heart disease every year than the year before. And it's killing 1,800 people every day in the United States. Yet we're not making a crisis out of that medical issue. And so I believe that we're in the midst of a massive health crisis in terms of chronic health. And if we don't change the way that we are looking at our health and getting to the root of what's causing that, then it's going to cut into our quality of life. And we're going to start having issues with a massive decline in the overall life expectancy. And so that's no matter to take lightly. So I'm going to ask you to get rid of any distractions that you have for a little while. Put away your phone, put on silent, close the door if you need to, turn off the social media, and just, we're so used to just multitasking all the time that we never actually get the full impact of the information that we need. So focus in here for just a little while we've got some big goals today. And yes, some of the things are going to be we're covering. If you've got symptoms like gas, bloating, digestive issues, we're going to talk about why those symptoms of indigestion relate to a deeper digestive issue that you don't want to ignore. We'll talk about foods that trigger gut inflammation and trigger autoimmunity, how to spot common gastrointestinal problems that keep you from absorbing critical nutrients that are important to your body's health and function. We're going to learn what most doctors won't test for when it comes to digestive health. Testing is key, and what to do to get started today so that you can reclaim your confidence in your body, get your mood back, and have peace of mind that your future health is going to be better, not worse. So let's talk about the digestive system. It really is magical. This little diagram does a pretty good job. Digestion starts from the time you pop some food in your mouth and you start chewing. Amylase comes out, starts digesting in the carbohydrates, preparing it for the stomach. Then carbohydrates, fats, proteins hit the stomach, and the acid in the stomach, which has to be very acidic, starts to break down and denature the proteins. That's where most of the proteins get broken down, is in the stomach. Meanwhile, different enzymes from your pancreas and your liver start to digest the carbohydrates. So then the food dumps into the small intestine where, the pancreatic duct and the bile duct get involved. So your gallbladder gets involved and it gets to say, hey, yay, I get to do some work here. And the bile from your gallbladder breaks down and digests the fats, while the pancreatic duct starts to break down and digest the carbohydrates. So now your small intestine is sifting and sorting through all these things, trying to take vitamins, minerals, nutrients, and make them smaller and smaller so you can absorb them. So this is critical that these functions in the digestive system are working properly, or if they're not, the gallbladder is not working, the pancreas isn't working, the stomach's not acidic enough, you're going to get bloating, you're going to get indigestion, you're going to have malabsorption, and you're going to run into nutritional deficiencies that lead your body to wasting away instead of building up. So now the gallbladder helps to extract fat-soluble vitamins like A, D, E, and K. So if you're not breaking down your fats, you're not getting those critical vitamins to your health. And then if if those healthy fats are digesting properly, they're also going to break down into what are called short chain fatty acids, SCFAs. And these are critical. These fatty acids, your bacteria love to feed on them. So the good bacteria. So a lot of people don't realize that. Your gut bacteria love certain short chain fatty acids. So as the food is moving through the small intestine, this is where you're getting the fiber from your food. Your body starts sorting and sifting what it needs and making everything that's useful. And the bacteria start to clump together. And by the time that food hits your large intestine, that's when the stool starts to form. And the crazy thing about this is when another digestive process starts based on the bacteria in your gut. And you can either get more caloric intake or take it away, depending on how healthy your bacteria is in your gut, your microbiome. And what researchers have learned, and you take the Weizmann Institute study, which has done phenomenal research on this. The glycemic index, it's not correct. We got to rethink that. That's one of the myths. Calories in do not equal calories out. It is not a one-for-one exchange. So a lot of people start thinking, oh, I got to cut calories in order to lose weight. And it's actually the opposite. You got to eat more healthier calories for your body to lose the weight. So it's actually the large intestine that influences the amount of nutrients and the amount of calories you're going to get out of food. So it's pretty crazy. So then you have a good bowel movement, and ideally you want to have, like my teacher said, I hate to go here, but you need to have a foot-long floater. And then that way you know what's the scoop on your poop. So interestingly, the thing that gives you the stool, again, is your bacteria. So let's talk about your microbiome, because the microbiome, which is your living organisms in your digestive system and throughout your body, it's critical to your health. Inside you are just teeming with life. This, again, is called your microbiome, and it influences your entire health. Your body, everything is dependent on this microbiome, being healthy. And the funny thing is, in our culture today, especially in the midst of a pandemic, we are killing all of our microbiome, and we don't realize that it's actually impacting our immune system. And the microbiome dictates how well your genetics behave as well. It interacts with the environment around you so that it helps to activate your innate and your adaptive immune response. So it's very dependent on the diet and the foods that you eat. We look at the bacterial content of your nose, your mouth, your lungs, your stomach, your colon, the sexual organs, your skin. And this is all a symbiotic relationship that we have. They are not the enemy. This is including viruses, fungi, and all the microorganisms in the world. So they're not the threat. But yet, one of the reasons we're in this health crisis, and one of the reasons that we're going to talk about today, is why you have the digestive issues that you've got, is because we've disrupted this microbiome, okay? So if you've got symptoms, gas, pain, bloating, heartburn, how many of you are suffering with these types of symptoms? Just raise your hand on the raise your hand button and let me know if you've got some of these types of symptoms going on. Okay, Ramesh, Maraz, okay. You guys are in the right place. So how many of you are tired of always feeling this way? How many of you are feeling like this is going on, too long? You go to sleep at night and you're like, I better take my Tums, and you're not realizing that every time you take Tums or an antacid, a PPI, that you're actually putting more fuel on the fire. You're stopping the hydrochloric acid production in your stomach, and you're actually causing more harm than good. Because what happens when you take omeprazole is when the food hits your stomach, it can't digest. And then the frustrating thing is it hits your small intestine, and then it putrefies. No wonder you're bloating. No wonder you're puffing up. Your stomach's not digesting your food. Your small intestine can't, it ends up getting infected. And the infections cause you to get these migratory patterns of bacteria back into your stomach. And then that changes the acidity. And then you end up eating more getting more acid reflux and eating more acid blockers that keeps throwing your stomachs more and more and more out of balance, causing more harm than good. So how many of you are holding back from the things that you once loved because of always like needing a bathroom, or you can't go very far without your pills, right? So it's, I've got friends who, they say, well, I want to go on this hike, but, I want to make sure that there's a bathroom, and I can't go more than 30 minutes without, when I'm exercising, because I just get cramps. And it's a frustrating thing for many of you. So, some of you are even embarrassed of that situation, because of your gas and your bloating. You get bloated, you look like you swallowed a bowling ball. You look like you're pregnant. And this is a problem. And right now, IBS is a major issue in the United States. It is one of the most, irritable bowel disease and irritable bowel syndrome. It affects 1 in 7 Americans. And this is causing a lot of stomach pain for you, those of you that have it. But not only that, it has activated an autoimmune disease in your digestive system. Your immune system has now started attacking your bowels, thinking that the bowels are the invader, the bacteria or the pathogen. So the good news about these types of things is they can be actually reversed. Now, let's talk about the dangers of bloating. How many of you have bloating in your digestive tract where you have to, like this picture shows, you have to undo your pants just to feel, comfort? This is a dangerous symptom because it blocks the flow of blood to the heart, damaging the heart. So you're increasing your risk for heart disease and heart attack from bloating. It also allows bacteria to move into the small intestine and infect the small intestine, creating a condition called SIBO. So yeah, I have some patients come in and they say, yeah, I look pregnant. And that's actually, a significant issue because your stomach starts to distend and it has that gas and the blood starts pumping into your stomach and you can start to get some collateral tissue damage. And that tissue damage can lead to a weakening of the overall acidity production. And then you gather some of the receptors that allow your body to make the enzymes necessary, and it can lead to more future bloating. And so don't just dismiss bloating as, yeah, I get it. So what? What's the big deal? There are significant implications to this that you don't want to ignore. And the more it happens, if it's happening every day, think of it just like little daggers going into your heart every day that you're some people wonder after a number of years how they ended up with heart disease. And what we find is that it usually starts with digestive disorders. So intestinal cramps and constipation, the other thing, if you're getting constipation and intestinal cramping, this could be an early sign that you've got Parkinson's going on. Now, how many of you have Parkinson's in your family history? You've got to really pay attention to that, because if you've got that brain and digestive system not functioning and not communicating, your digestive system is going to be sluggish and slow, and it's going to lead to issues down the road that are significant in terms of Parkinson's and other autoimmune diseases that are started in the gut. So let's talk about an infection that's really common. H. pylori infection causes peptic ulcers, and the bacteria weakens the protective mucus coating of the stomach and the duodenum, and it also allows acid to get through the sensitive lining beneath it. So both the acid and the bacteria irritate the lining and cause a sore called an ulcer. And as this continues untreated, or if you go into your doctor and they just give you antibiotics, guess what? That's going to just repeat. It's not changing the environment of why you got infected in the first place. All it's doing is killing off the bacteria. And we talk to so many patients that say they've had second, third, fourth repeat infections with H. pylori, like it's always coming back. So that tells me that antibiotics are not the answer. We've got to figure out what's going on at a deeper level to find out why your body is allowing the H. pylori to get in there in the first place. And taking antacids and repeat antibiotics is not treating the root cause. All right, headaches. How many of you got headaches and brain fog? You can't even think straight. You can't concentrate on your work. You're tired and sluggish in the afternoon. These are symptoms that you've got to be careful of and not ignore. This is the problem with chronic health disease in our country, is we often just push it off to the side and just try to push through. And this idea that only sissies get help and take care of their health, that's a terrible belief. That's a terrible meme that's in our culture. Because when you ignore the symptom, that's, how many of you drive a car And if the engine light comes on, you just ignore it. You pretend it's not there. That's not the smartest thing to do, is it? Why would you do that with your body? So we've got to ask the question differently. What's causing my symptoms? What's the cause of my bloating? Why do I have stomach pain? Why do I have headaches and brain fog? Why am I constipated? Because the cause is the most important takeaway from today's webinar that I hope you get out of this today. If you've been having these issues, you might know already that they're very poorly treated in our medical system. In fact, 50% of GI doctor related visits are misdiagnosed. When you go to the hospital with digestive issues, unless you're bleeding, they don't really do anything for you. So part of the reason the system is failing you is because you've been struggling, you've been looking for answers. It's not your fault. It's the information you've been given. When I was in school, at medical school at Bastyr University, one of our GI docs at Bastyr was one of the best in the country. He admitted that half of all the GI issues are misdiagnosed. That's where I learned that. So you're going to not be treated properly if you get the wrong diagnosis. And how do you get the right diagnosis? You've got to do the right testing. Most of the time, doctors are just kind of guessing. Let's try this and see how that works. And if it works, great. They just kind of throw enough darts at the wall and one of them is going to stick. But how many of you like the guessing game with your health? Wouldn't you rather feel more confident if you had evidence-based testing that pinpointed exactly what is going on? If you've got H. pylori, why did you get H. pylori? There's another reason. You've got to back it up and go, there's something else going on here that allowed this to occur. So what you need is to get the right testing to uncover what the root cause of, because most of you are going to get a diagnosis like IBD or IBS or Crohn's or diverticulitis, and you're not finding out what's causing those conditions. And that's what's wrong with that's why we have a health crisis in our country, is because 76% of all doctor visits for chronic complaints end in a drug prescription. Now, what's wrong with medications? Yes, they can be life-saving, but what is it that they're treating? The symptoms. How many of you are on 5 or more medications or know someone who is? This is called polypharmacy, many drug syndrome, and you have symptoms caused by the medications themselves. One of our patients, Don, he was on 16 medications when he came to us. He had rheumatoid arthritis. It all started with his gut. He had irritable bowel disease. They put him on Humira, and that led to another autoimmune disease. And then that turned into rheumatoid arthritis. And to make matters worse, his kidneys and liver were failing. He finally got all his specialists to meet together. Their solution was one more medication. Don realized that he had a choice at that point. He could take his health into his own hands, do something different about his health, or he could keep just following the conventional route, keep taking the medication, and keep spiraling downward, getting worse and worse. So his daughter was able to at least get him in for an appointment with us, because she had been through a program with her own health with us and completely transformed her health. So she brought her dad in, and she said, we need to do regenerative medicine, stem cells in his knees. We need to do, figure out what's going on to get him off these medications, because it's making him worse. It's making him sicker. So we told him, there's not going to be any magic bullet fix here, Don. It's going to take a process. You're going to have to commit to a year-long process working with us in a program. And I told him, are you willing to make changes in your life? And he said, that's what I've been asking for. That's why doctors just kept telling me I just need to lose weight and my health problems go away. and I can't lose weight. I've been trying for 15 years to lose weight. There's something going on underneath them, and that's what I need to find answers for. I told him, let's get the testing. We discovered some microbiome imbalances, some gastrointestinal inflammation, discovered his autoimmunity. And that's, guess what? Autoimmune diseases start in the gut. So once you start fixing the gut, you can put the autoimmune conditions into remission. And then you don't need the medications anymore. The medications, this is, these are the type of medications. When you're prescribed drugs that have negative long-term consequences on your health, most of these medications are destroying the bacteria in your gut, and they're causing a condition called leaky gut. So they're making your problem worse. Immunosuppressive drugs, methotrexate, Rituxan, Humira, Enbrel. Corticosteroids are one of the most commonly prescribed anti-inflammatory drugs. And after a while, these corticosteroids will suppress your immune system to the point where your immune system collapses altogether. Now, what do they call someone who has no immune system? Does anybody realize what that is? That's a medically induced immune deficiency syndrome. There's another condition that causes this. It's called HIV. HIV destroys the immune system. Did you know that these medications can also destroy your immune system, making you a medically induced acquired immune deficiency syndrome patient? That's dangerous. So that's why we don't want to ignore these medications and just take them lightly. So we've also got to consider food as medicine. Glyphosate is a chemical that's made by Monsanto, and it's highly toxic. Look at this picture, and you've got farming before and after Monsanto. Back in the organic days, all food was organic. Nowadays, it's all chemical. And then we eat these chemicals in our food supply, and it's no wonder we're having toxic overload and our immune systems are collapsing. So this is another thing that can collapse your immune system, is toxins from our environment and our food supply. So you've got to make some changes there. Now, what are some other things that can destroy your digestive system and cause digestive health dysfunction? Well, physical injuries, physical traumas, emotional traumas, like we just discussed, chemical and toxin traumas, and finally, immune system impacts. So repeated infections with repeated antibiotics. All four of these are what we call the 4 negative stressors. And this is what leads to a buildup over months and years, leading to a tipping point where it tips your body into a collapse, where you've now got symptoms. And it seems like for some of you, it just happened overnight, but I can tell you that by the time you got the symptom, it had already been coming for a long time. It had already been in decline. Your body had been heading there. And the symptom is the last thing to show up before the disease. So this is why it's so critical to not ignore symptoms. It's estimated by OSHA that we're exposed to over 80,000 chemicals on a weekly basis, and only about a quarter of those do we know the toxicity effect on the body. So, you've got to take these 4 negative stressors into consideration and modify them going forward, or it's just going to be a temporary fix. Now, stress definitely impacts the bacteria in your digestive system, and this will cause the effect of depression, symptoms like depression, lack of motivation, moodiness, poor libido. It triggers leaky gut, small intestinal bacterial overgrowth, and then finally you get a disease diagnosis like IBD or IBS. So stress is a huge factor. Your daily health habits, how much exercise. Don't let me catch any of you doing this for your exercise, okay? This is just an example of how daily health habits and exercise are critical for gut health. And you just can't leave it out. This is one of our classes that we teach our patients that we work with in our programs. The class that we teach is called We Can't Exercise For You. So if some of you just don't enjoy physical exertion, you're going to have to change that mindset altogether, because that's part of how you maintain health throughout life. So again, just to recap, who am I? I'm the founder of Pinnacle Integrative Health. We're most famous for helping people just like you correct chronic digestive disorders and imbalances, getting to a permanent correction, getting it fixed. And our teams do this through a process of regenerating your body's tissues, normal healthy tissues, functional, getting the normal healthy function back. And we do this with regenerative, functional, and ancient medicine techniques, all combined together. We call this collaborative medicine because we collaborate with our patients. You don't just come to us and we give you a new magic bullet drug. It's a process of correcting the dysfunction. And the good news is we've figured out a pretty simple way to get rid of digestive issues. We're going to walk you through that today. So how many of you are ready for a total gut makeover? Just a big hit the reset button. Start over, get a new lease on life. And you'll have the opportunity to schedule a consultation, an evaluation with our team to get to the root of your problem, see if we can help. And that this is a comprehensive approach. It's not just about taking a pill for your acid reflux. This is going deep, looking at physiology. Let's look at a case study here. This is Jill. Jill's journey, she had gastroparesis, anemia. She was losing weight. She was down under 100 pounds. She was malnourished and losing weight rapidly. She had food allergies. She'd already tried all the fancy diets, the specialists, the cleanses, the detoxes, you name it. And she was rapidly losing weight, running out of options. How many of you guys like and enjoy running out of options for your health? Does anybody like that process? I know I don't. So Jill hit a rock bottom. When she realized she had all these symptoms, the fatigue, the bloating, she always felt like she had the flu. And her doctors kept telling her, your labs look normal, Jill. Don't know what to tell you. They tested, there's no parasites. You don't have any diverticulosis. There's none of that. She just realized, okay, what's going on? Why do I have this? And this is not the life she wanted to live. So when we looked at her labs, we taught, her and her husband came in. They committed to finding answers first and foremost, not giving up. And they came in for a consultation, and we told Jill that, this is going to be a process. We're going to have to find answers through testing. And are you willing to follow recommendations of a program, a structured program that guides you through each step along the way? Because there's an order of operations to restore the function. She said her and her husband realized that they were willing to invest, number one, the time and the money in their health, because their health is worth it, and that they weren't getting the answers they were from their conventional medicine, which was just recommending drugs. And then when the drugs stopped working and they weren't responding anymore, then surgery was the next option. So how many of you like those two options, drugs and surgery? That's what our conventional medical system is. So if you want out of those options, you want to fix the problem, you've got to commit to a change. And committing to a comprehensive digestive health program, we told Jill there's not going to be any silver bullet. We got to start with the corrective health testing. Then that would give us the right diagnosis, the right treatment, the right therapy, functional nutrition tailored to Jill, acupuncture, and we mentored her into her new healthy lifestyle, coaching. Now this took time because we had to take her step by step to show her so that she understood how it was that she got to where she was. So our digestive health programs are a system. It's a system. And 94% of all failures are due to a lack of a system. And also a mindset that, if my insurance won't cover it, then I'm not going to get it. So if we've got that mindset that I'm going to get whatever my insurance will cover, then you're going to keep getting what you've gotten up to this point, drugs and surgery. So what happened for Jill is she went through a gut health transformation. Her entire health from the ground up reversed, put her autoimmune disease into remission. She started gaining weight in a good way, lean muscle mass, not fat. And she has more freedom for food choices now in her life. She's got her lifestyle back. She's sleeping better. She's got more energy. Her immune system's stronger. And now she's got better quality time with her family. So we weren't focused on the symptoms for Jill, but rather her entire systemic health from the inside out. So what would happen if down the road, 3 years from now, if nothing changes for you, you're still doing the same things you've been doing up to this point? What's your health and quality of life going to be like? Is it going to be worse or better? If you look at 3 years previously, where you were at 3 years ago versus where you're at now, are you worse or better than you were before? And now fast forward 3 years down the road. Okay, if you don't take care of the problem, it is going to get worse, period. So now when it comes to intervening on the root cause of digestive health, you have to take into consideration all the things, just like Jill did. You've got to find out what foods are triggering inflammation. You've got to do testing that diagnoses leaky gut and digestive disorders and weight gain or weight loss, hormone imbalances. We got to test for the hormones, and we got to test for autoimmunity, because poor health starts in the digestive tract. And like I mentioned before, what we've seen is the connection. More and more research is coming out with the connection between brain health disorders and neurodegenerative disorders like Parkinson's, and early, many years prior, chronic digestive disorders. So there is a connection there. What if you could totally prevent any of that from occurring? That takes information. So you got to eliminate genetically modified foods. You got to eliminate glyphosate. You got to eliminate soy, gluten, peanuts, possibly eggs, and most likely dairy, because these things, gluten, for example, is a protein that's very difficult for your body to break down and digest. We just don't have the enzymes for the genetically modified gluten that's in our food supply today. Gluten can trigger a whole spectrum of autoimmune diseases. So if you've got it in your joints, you're going to have rheumatoid arthritis. If you've got diabetes, if you've got thyroid disorders, Hashimoto's, Graves', if you've got chronic depression and anxiety, all of this can be tied to gut health and how triggered your body is to gluten. What about dairy? Dairy, a lot of people are told by their doctors, drink more milk so you get more calcium. And that's another myth. Your body can't even, that milk is fortified with low quality calcium that your body can't even absorb. So it doesn't even matter. It's not nutritious. It's triggering systemic inflammation and leaky gut. So leaky gut can be triggered by,
I'm having trouble hearing you.
Sorry. Leaky gut can be triggered by toxins, by stress, undigested food particles, medications, infections and pathogens, and liver organ malfunction. Fatty liver disease causes the digestive function to decline to the point where the microvilli, the enteric cells, start to become so inflamed that they can't stick together and create the tight bonds. So these tight bond junctions break apart, and that's what's letting things into your bloodstream that should not be getting in there. And then that triggers your whole immune cascade, setting off autoimmunity after a certain amount of time. Glyphosate breaks the tight junctions in the digestive tract, leading to leaky gut. There is hard evidence of this. Then leaky gut affects the whole body. You start to have skin problems, brain problems, neurodegenerative disorders, chronic sinus issues, environmental allergies. Your joints start to deteriorate, your adrenal glands break down, and your digestive system, and the whole thing just keeps cycling. So this is why you can't ignore, you shouldn't ignore your digestive symptoms. There's something else going on. So we've got to really look at, if you've had chronic antibiotic use, NSAIDs, drugs, your drug history, traumatic brain injury, is there chemotherapy, radiation treatments that you've gone through? Is there gut dysbiosis, hormone imbalances, chronic inflammation? We've got to look at your diet. We've got to look at your lifestyle. How many alcoholic drinks are you drinking per week? That's going to be a factor. All those things, your lifestyle is an important, critical role. That's the only way we're going to fix this. That's the only way I've ever seen it. So in your gut, your microbiome, the bacteria and hormones can cause weight gain. So if you have the wrong kind of bacteria in your gut, it can cause you to gain weight in different ways. One is belly fat, one is hip fat, one is overall body fat, and one is fat around the visceral organs. These are the 4 different body types. One is cortisol, the second is estrogen dominance, the third is deficiency of thyroid, and the 4th is insulin, basically fatty liver disease and insulin resistance, or type 2 diabetes. So if you recognize yourself in one of these 4 body types, you can spot common hormone imbalances. And then what do you do about it? Well, you need to find someone who's trained in functional medicine to know how to correct that dysfunction. And without testing, you're just guessing. So here's an adrenal fatigue and digestive disorders test that shows us the connection there, where your cortisol should follow a normal rhythm in the green, and actually the patient's blue line there is showing us what's going on and what we need to do about it. Depression, anxiety, and brain fog all relate to your second brain, the gut. The gut is where you have second most collection of neurotransmitters like serotonin and dopamine. So that's why depression and anxiety are usually, the symptoms are treated with antidepressants. But when you get the gut repaired, the symptom of that dysfunction in the gut, which is depression and anxiety, is resolved. It's treated. Now, unless you're doing, how many of you know that you have leaky gut? How many of you suspect it? Well, you have to test for it. You can't just guess. Some of the tests we run are lipopolysaccharide tests, the zonulin inflammation marker. These are some of the most important markers. And if you don't test for them, you're just going to be guessing. Another test is to determine if you have small intestinal bacterial overgrowth. So this is done through a stool test that can detect hydrogen in the stool. Also, if you got chronically bad breath, really halitosis, bad breath all the time, you got to look at what that hydrogen and methane gases are coming out of your small intestine. And you've got to do testing that can detect both the good and the bacteria. Because if you have an overgrowth of Campylobacter or Enterococcus or Clostridium difficile, C. diff, right? You could have C. diff and not have symptoms, but you're going to have severe health problems because of it. So that requires a comprehensive stool test, looking at any infections, measure the inflammation levels, measure the levels of enzymes, looking at the imbalance in the flora, seeing if you've got problems with absorption rates and digestive rates, how well your digestive system is breaking things down. One of our patients, her name is Connie, pictured here. This is her story. She says, I've been going to Pinnacle Integrative Health, and it's been a life-changing experience. I work in the healthcare industry, and I had been unable to get any help from traditional medicine for the symptoms I was having. Pinnacle Health helped me to heal my gut, eliminate the aches and pains, eliminate my constant autoimmune flare-ups, and brought back my energy. This confidence is very freeing after decades of pain and suffering. And my future looks great. I owe it all to Pinnacle Integrative Health. So if that's the kind of story you want to tell, then you're in the right place today, and you've got to take action. You can't just wait and wish for things to change and get better, because time is going to go by no matter what. Hopefully I've kept my first promise. I've dispelled some myths. Raise your hand if you guys would say you've learned something new today and I've dispelled some myths for you. You guys, raise your hand. Show me if you're paying attention here. Guys, Josephine, Anaz, good, awesome. So now comes the time to act upon what's next. What's the next step? You got some information. Now what are you going to do with it? How many of you would like to get scheduled for your consultation? Raise your hand in the chat function, if so, and we're going to help you get scheduled for consultation, evaluate your wellness, and come up with an actual plan to get you better if we feel like we can help. Now, normally, we charge for these consultations. The value of this is $287, but today on the webinar, it's a no procrastination gift. So there's no obligation. You've got nothing that is going to come out of this other than a little bit of time. And if your health is important to you, then you realize that finding answers is the most important thing you can do for your health. So let me explain how our program works. If we determine that we can help you and you're accepted into one of our programs, then here's how our program works. We got to order the correct tests. That helps us determine what the cause is. And then we can focus treatment on the cause, not the symptoms. We can correct the dysfunction, not just alter labs with drugs, which causes more problems. We address your body as a whole unit, a whole system, not just your symptoms. We use a systematic approach that includes mentoring, because many of us, we have all these myths, we have this misinformation about how our bodies function. So the systematic approach takes you through a curriculum-based healthcare. We teach you about digestive health and detoxification, how to detox your body. We take you through a customized nutrition and exercise regimen designed based on your testing. We teach you how to rebalance your entire endocrine system, from your thyroid to your adrenal glands to the pituitary and sex hormones. And then finally, we work on brain health so that your brain is working better. You're thinking clearly, you've got your focus, your concentration, and you got your libido back. So when you deal with the systemic inflammation, that's the key. We gotta step one, eliminate the inflammation. Step two, we've got to repair and rebuild. And step three is stabilize that. So ask yourself these questions. How would life be if I were able to resolve my digestive health issues for good, permanently? Now, how has my health affected my life to this point? How has my health affected my relationships, my ability to work, and my ability to enjoy life? I bet it has. And on a scale of 1 through 10, how motivated am I to really take care of my problem? Now, I want to explain a little bit, because we don't just accept anybody into our programs. We're looking for people whose health is their top priority, or at least a high priority. We accept what I call A and B students. We don't accept C students. Okay, and some of you are like, well, what does that have to do with my health? it's nothing to do with your GPA or how smart you are. A and B students are, you tell me what I need to do and I'll do it. My health is worth investing time and money and getting a permanent outcome, and then so that I can maintain it the rest of my life. A C student is someone who says, if my insurance doesn't cover it, then I'm just not going to do anything because I'll just get whatever my insurance covers. Or I'm going to think about it a little longer. I never make any rash decisions. I'm going to procrastinate. I'm going to talk myself out of this because I'm going to put it off for a little while longer. I'm going to figure this out on my own. Okay, great. So that's not a good fit for us. We want to work with the A and B students because those are the ones that we knock it out of the park with and get our, phenomenal health transformation outcomes. So, and the C students are just no fun to work with anyway. So, we don't want to have stressful jobs. So investing a little time now or be forced to take downtime and loss of quality later. Loss of quality of life later. That's the motto. Invest a little time now or be forced to take downtime and loss of quality of life later. So now is the time to decide what your future will look like. I know you can't go on like this for very much longer. Would it be ridiculous to ask you to put your health as your number one priority? Is that ridiculous to ask? I don't even know if we would be able to help you yet, which is why we need to do the live personalized evaluation and then talk with our medical team, and let's introduce you to our team approach here. All right, that concludes our webinar for today. Our next step is here's our team. We've got a team approach that we've got an integrative health, what we call integrative health. We've won multiple awards and we've been around since 2010. So in the last 10 years, we've helped over 30,000 people in the greater Seattle area and Washington State move towards health independence and beat their chronic and autoimmune and degenerative conditions. So that's significant experience and expertise that we're offering here. What is it that you're going to offer? Why should we accept you as a patient? We want to work with the ones that their health is their top priority. That's all we're requiring. Okay, so we can go ahead and conclude today's webinar. Bring John back here, find out if we got any questions.
Thank you so much, Daniel. That was great. Very informative and, like we promised, dispelling a lot of myths. I did not see any questions in the chat box. If anyone has any questions at this time, I'm sure Daniel or I and everyone here would love to field them. We did get a complimentary consultation from Manaz, so congratulations.
Congratulations, Manaz.
I will be getting in contact with you very soon, right after we're done here on the webinar, to get you scheduled. You'll be the first person I call. And if anyone else would like to sign up for that complimentary, Josephine, great, that's awesome. Thank you so much, congratulations. If anyone has any questions, we can field them now, but congratulations to the two of you first and foremost.
Okay, great, look forward to meeting you guys, and hope you have a great rest of your day. Turn on your phone so that when John calls you guys, you hear his call. And one last housekeeping item. We send you guys our questionnaire or paperwork that's electronic, and does require you to have a computer. So get access to a computer to fill that out. Don't do it on your phone. I know a lot of us are tablet and phone friendly these days, but it just doesn't work. So make sure you fill out that paper, that questionnaire, because if you don't, I don't know how I can help you. So that questionnaire is critical to me finding out what's going on and getting a little bit of health history so I know how we can best help or if we can help. So very important that you if you're making this a priority, you carve out 30 minutes just to fill out a questionnaire online. Super easy. Hit the send button, we get that, and then that lets me preview what's going on before we meet up. So I know we've got some appointments available this week. We've got a busy week here. So let's prioritize the first come, first serve. And we'll get you guys in this week and find out how we can help and start getting you some answers. All right, all good?
Yeah, with that being said, thank you guys all for coming. Thank you, Daniel, for talking to us once again. And